Ja. Okay, welcome to Deuk Spine Institute. We're going to be performing the Deuk plasma rhizotomy. This is a treatment for facet joint pain. Our patient has shot facet joint pain, and this patient has had the Deuk laser disc repair for his discs. He had disc pain, he had radiculopathy, but after surgery he came back and said, Dr. Deuk, I'm having a lot of back pain. And it was not coming from the discs, it was actually coming from the facet joints. We talk about the facet joints a lot. They are the second most common cause of back pain, following the disc being the first. He definitely had disc pain. We fixed those discs. Now his pain is off to the side, and it's in his facet joints. Again, second most common cause of back pain. So, we're going to be targeting the medial branch of the dorsal ramus. The medial branch of the dorsal ramus is the nerve to the facet joint. Shot. It is a pain nerve. All it does is bring pain. Pain from the facet joint to the brain. And there's a technique we use when we target this nerve, and we call it the Deuk shuffle, where we literally shuffle along. You see the tip of that, Jordan? Show the audience. Right where the tip of that probe is, folks. That is exactly where that nerve is. Couldn't be more precise than that. All right, moving on to the second one. Shot. Shot. Our patient travels to us from New Hampshire. Not the old Hampshire, the New Hampshire. You like that? My jokes are a little corny at times, but hey, I get the job done. Shot? All right. You see that? Jordan, show us the transverse process for the audience so they can see where we are and just what we're doing here. There's the transverse process. Shot. So we're literally at the junction of the transverse process with what's called the superior articular facet, and I can feel it. I'm on the bone. It's very important if you do this procedure, you're on the bone. Is that it? Mm-hmm. You don't want to be below the bone, you want to be directly on the bone. Shot. Mm-hmm. Shot. Shot. All right, I am on the bone. It's called the transverse process. Again. Shot. And it's right where the TP meets the superior facet. That's the lower end. Shot. Very nice. Feels really good. He has very clean anatomy. Just want to make sure before I leave I've gotten all the areas that need to be gotten. Shot. This should be the last place right here. I can actually feel the pain nerve. All right, it's 2 down. And let's go ahead and see if I can't give some more num-num. We've got 2 down, we got 2 more to go. I'm just giving a little bit of numbing medicine to make it more comfortable for our patient. All right, I'm going to head down and find the next place. Now this is a minimally invasive procedure. It's not done at the hospital. We do it outpatient. That looks good, huh, Jordan? All right. Again, the medial branch of the dorsal ramus is our target. Shot. Medial branch of the dorsal ramus. It is also the same target for what's called an RFA. The problem is the RFA doesn't work so well. RFAs, if they do work, they give patients just temporary relief. Shot? And we want our patients to have permanent relief. What do you think, Jordan? I mean, that looks like we're right there, doesn't it? You think we're too far south?
I think just a little too far south.
Shot? I mean, I feel bone right on that spot. Shot? This is just 30 seconds, Dr. B.
Okay.
You think you like that there? I like that. That should have done it. Thank you, everybody.
Thank you.
Let me show you, folks. Henry, can you see this?
Yes, we can.
That's our blood loss. It's just a few drops. It's nothing. And there's the whole incision. So we're going to close this up with just a little steri-strip or a what are we going to do, a staple? All right, let me have the stapler. We're going to put a little staple. It's really not bleeding. 1 staple, we'll get it out tomorrow. He did really well. And that should fix the facet joint pain. Okay? Yeah, just 1. Great job, everybody. All done. Any questions, Henry?
No current questions.